All right, there's a lot of talk about a vaccine for kids. 2 vaccines, in fact, have been cleared for the same in India, but it's still not out. Kids are not getting vaccinated yet. Why? Because there's still a lot of questions over what to do really and how to vaccinate children who have underlying health conditions. Now, the government will be holding a meet. You've got the technical advisory group coming together this month sometime to discuss exactly what is the policy for vaccines for kids.
Surplus of 31 crore COVID vaccine doses. Exports of both Covaxin and Covishield now allowed. 2 vaccines cleared for pediatric use. So what is stopping India from vaccinating its children? A decision was taken in principle to first vaccinate children with underlying healthcare conditions. Then came the stumbling block, a lack of clarity on who these comorbid kids would be and what would be the process to vaccinate them. The government's National Technical Advisory Group is now going to meet towards the end of November to firm up a policy for vaccinating kids. Top government sources analyzing the risk-benefit ratios say that India will have a guarded approach towards vaccinations for kids, given that none of the vaccines have a regular approval and both Govt and Covaxin have approvals for emergency use. Children do not fall seriously ill, and if the rollout takes a while, so be it. The good news is that ICMR's own survey shows high seroprevalence in kids, which means they have had some amount of natural immunity.
Going to school is conditional to teachers having the vaccine, staff having the vaccine, and following the SOPs in the classroom as well. And also having parents that are protected. So please, let's focus on that in a concerted way. There are stages when there is priority A and then we move on to other priorities. Clearly at this moment, even in the interest of children, the universal vaccination of adults is critical.
But worried parents want their children vaccinated before sending them to school. Some experts back these parents.
We have seen since early 2020, the initial incidence of COVID in children was just 3%, rose to 9% by end of last year, 2020, and then 22% by early part this year, and now CDC data shows it's 25% of the overall incidence of COVID is in pediatrics. MISC, the multi-inflammatory syndrome in children, was 0.1% earlier, and now it's 1%. So obviously the incidence in children is rising, and so are the multi-organ involvements of COVID.
Meanwhile, there are some parents, of course, who are willing to take the risk.
Trial sizes are ridiculously small, and so we still don't know whether these vaccines could have long-term effects on our kids. Some people say that vaccinating kids will protect the adults surrounding them, but everything is open. Everything else is open except for schools. So it makes no sense. For my child, the costs of this 600+ day school closure are really stacking up.
Covaxin's dose for kids above the age of 2 has been approved by the expert panel, but is yet to get the green signal from India's regulator.
Children vaccine we have done complete all our clinical trial. It is with the government. Government has to take a decision, not us. And coming to the nasal, we completed a phase 2 trial now, and I think we are compiling the data. And data seems to be extremely good. And now we need to see how to go about it.
The other vaccine, Govt, has been certified for those between the age of 12 to 18. In New Delhi, Sneha Mordani for India Today.